Dean Holtgrave, Ph.D., serves as the Dean of the School of Public Health, University of Albany, State University of New York since March 2018. He is also appointed as a SUNY Empire Innovative Professor and SUNY Distinguished Professor. Prior to UAlbany, David served as a professor and chair of the Department of Health, Behavior and Society at Johns Hopkins Bloomberg School of Public Health and was appointed to an endowed professorship. Dr. Holtgrave has worked extensively in the field of HIV prevention since 1991. His research has focused on the effectiveness and cost-effectiveness of HIV prevention intervention and the translation of these studies' findings to HIV prevention policy. In 2020, Dr. Holtgrave became heavily involved in the partnership on projects with the New York State Department of Health to address a number of public health concerns related to COVID-19. Welcome, Dr. Holtgrave.
Terrific. Thank you so much, Carmelina. I really appreciate that introduction. And I want to thank you and the Alumni Association for having me today. I really look forward to the discussion.
Thank you for joining us. We do too.
Thank you very much. And also, I just wanted to recognize Dr. Applyrs. I know that she was having a bit of a computer connection issue earlier. And just to say that Dr. Applyrs is an amazing alum of the School of Public Health, continues to be a faculty member in the school and a tremendous partner and advisor. So I just wanted to say it's such a great pleasure to get to interact with the Alumni Association overall and also to interact with Dr. Applyrs in particular. So I will try and share my screen here and see if I can do that without causing any difficulty. Let's see if this works. Very good. And I think that I really wanted to do two things today, as I understand the purpose of our discussion. The first is to give members of the Alumni Association a little bit of an update on the School of Public Health. What are some of the things that we've been up to, some of the themes of our more recent work. And then I'll save a few minutes at the end to talk a little bit about our work in COVID. And I think that many of you know some of the work we've done in that space, but I want to hit just a few of the projects and name some of the themes that we're doing there. And then very happy to open it up for comments, questions, and suggestions as we go further. So to start off with, I wanted to refer you, if I could, to our school's 35th anniversary magazine. This magazine lives on our website for the School of Public Health, so you can find it there very easily. And this magazine is in a reader format under issues. So if you see this front cover on our website, you can click on it and then go through this in the application called Issue. So again, our last year was our 35th anniversary for the School of Public Health. And it's really important, I think, sometimes to reflect on the history of organizational unit. 35 years ago, now 36, Dr. David Axelrod, then the commissioner of health for the state of New York, had this vision that the New York State Department of Health and the University at Albany should come together and start a School of Public Health that would bring together DOH, Wadsworth, UAlbany in a really rigorous applied school that both had cutting edge science, but was informing real world programs and real world policy discussions. And this quote from Peter Millock summarizes it well, that Dr. Axelrod was an innovator. He showed by his co-founding of the school forming virogenetics to commercialize scientific advances in the Wadsworth labs and many other actions. His initiatives more than 3 decades ago reverberate in the state today, and that is true. And we've now launched a prize in Dr. Axelrod's honor. And last year we offered the inaugural Dr. David Axelrod Public Health Prize, and we had great nominations, great candidates for it. And it was awarded to Professor Tom Burke of Johns Hopkins University, who was the deputy commissioner in New Jersey, then a major science advisor at EPA, and also had a career in academia, very much in the legacy of Dr. Axelrod. And this year we'll be offering another Axelrod Prize, and And we've also got amazing nominations again this year. So we're continue to be very numbers from the magazine to talk about for the school. Of course, we still have our 4 departments, biomedical sciences, environmental health, epi and biostat, and health policy management and behavior. And overall, those departments and the school offer 17 degree programs. And our MPH requires 720 hours of field placement. That's about 3 times the amount of most other schools of public health in the country. So our tagline now is defining experiences in public health with the emphasis on the word experiences. And it's really true. We have a tremendous emphasis on not only learning in the classroom or learning online, but learning in the field as well too. We have 9 centers and institutes such as the Center for Health Workforce Studies, the Center on Cardiac Issues, the Cancer Research Center, which is doing amazing work in a number of areas, including looking at vitamin D and cancer. And we have over 20 global partners, and our student body now has representatives from about 36 countries. So we've become very much a global school as well. And we continue to be ranked in the US News and World Report rankings as one of the schools that earns the quote unquote best graduate schools for public health distinction. So we have the right to use that title from year to year. And I think, as all of you probably know, we have a tremendous emphasis at U Albany, and in particular at the School of Public Health, on addressing health disparities, and not just identifying health disparities, but also really trying to make sure that we're doing something about health disparities, that we really are trying to build health equity. And I'll come back to that theme when I talk about some of our research trajectories in the school, because I think the issue of health disparities absolutely cuts across many of the different kinds of projects and lines of research, to say that we have really been very fortunate for a number of scholarship programs. And I just wanted to mention one from Ms. Adele Smith, who sadly has now passed from us. Ms. Smith was an executive assistant at Haney's, and really saw that it was important to provide scholarship funding for young women, especially women of color, in public health, to be able to advance studies in healthcare and population health and health equity over time. And certainly this has been a very successful scholarship program, and we are so appreciative of the support of Ms. Smith. Again, sadly, that we no longer have her here with us, but the continued support of Haney's as well. Also, the school, as I mentioned before, in terms of the countries represented by our student body, we really have a very vibrant global health center led by John Justino. And even in the times of COVID, it's been really quite remarkable. So we have tremendous partnerships in a number of countries, especially partnerships with Costa Rica, China, the former Soviet Republic, the state of Georgia, the Ukraine. We really have a number of countries where we have very real, meaningful research and training partnerships. And I just wanted to mention that even last year, John Justino and a number of colleagues really found ways to continue to make those partnerships work, even in a time of COVID. A lot of things had to be converted to digital format, distance format. And while we missed having our students in the field for those experiences, as well as welcoming to the school, we now have had a number of cohorts from China and from Costa Rica, especially, coming to the school for visits over the summer, for instance. Couldn't have some of that face-to-face interaction, but found ways to continue to do it at long distance. And hopefully soon we'll be able to continue this face-to-face as well. So this continues to be an important and growing global presence in the school. And speaking of students, I just wanted to say that our students did amazing work in the time of COVID, led by faculty members like Tomoko Udo, Eli Rosenberg, Janine Jurkowski, and a number of others. We have some pictures here of some of our students during the time of COVID who were serving as physicians on the front lines, giving patient care, students who were working in the labs, including Wadsworth Lab, students who were working on research, data analysis, like looking at epidemiology and surveillance data, students doing testing and contract tracing work, and more recently volunteering to provide some support around the vaccination efforts in the capital region. And we couldn't be prouder of the work that our students have been doing. They really have jumped in and worked on a number of frontline projects related to COVID-19. This was always true. Their community and their community partnerships, their public engagement before COVID, but even more so exemplified during the time of COVID. And they've worked with the New York State Department of Health, with Albany County, Schenectady County, a number of other different counties and community-based organizations and healthcare provision systems in the capital region. So again, kudos to the students at the University of Albany School of Public Health for all they did to try and address the pandemic. So I'll come back to COVID in a few minutes, but I wanted to just name a few other lines of research that have gotten to be really important in the school. And there's so many important lines of research at the school. I could go on and on. I'm just going to name a very few of them that are featured in the magazine. One of which is the work on environmental health sciences and especially contaminated water. And we see this in the work of Aaron Bell, and then also over at the Wadsworth Labs, Nick Mantis has a faculty appointment with us. And they've really looked at, for instance, Dr. Mantis, at cholera caused by pollution in drinking water, and more in the capital region and in New York State. There's been a lot of work looking at PFAS in Hoosick Falls and other areas that's been led by Dr. Aaron Bell. And I think that the school has become an important voice in research in this space. And recently there's a major new award that Dr. Bell received to look at a multi-year project in the Hoosick Falls area around PFAS. So we're very pleased that we get to continue to collaborate and in the years to come. Also, I wanted to mention some of our work in diabetes, work from Dr. Elizabeth Vasquez, who's now the chair of the Department of Epidemiology and Biostatistics, and the work of Dr. Julia Hastings in the school. And they've done kind of different aspects of diabetes, but both have an important emphasis on health disparities as it relates to diabetes care. And just one project to mention that Dr. Hastings has recently done is really focused on the issue of how people, especially in African American communities, most prefer to receive information about adult type 2 diabetes. And one of the things that she really found was that people had a tremendous preference to hearing information in person and be able to have in-person dialogues as opposed to just receiving information digitally or just paper and pencil kinds of information. So I think this line of research is really important because it helps us to think about health disparities as it relates to diabetes, to look at communities most heavily impacted by diabetes, and then trying to test different approaches to building health equity, for instance, in how diabetes information is communicated and delivered. And it seems like the channel of providing that information really makes an important difference. So I wanted to mention that work to you today. Also, wanted to talk a little bit about our work in health communication. Work led by Dr. Jen Manganello is really key, and you've probably seen her Twitter account during the time of COVID. And she will tweet about COVID itself, but a lot about how people talk about COVID. How do they frame their messages? How do they talk about numbers versus words versus personal stories? And what are some of the ways that we can most get accurate, reliable information to people in a way that's understood and that's used over time. I think this is a continuing area of emphasis and growth, and I just wanted to mention our health communications work to you today. Another theme that we see a lot of in the school now is work related to food supply, food insecurity, and other aspects related to the food system in the US and beyond. So for instance, Dr. Tomoko Udo has done some work looking at eating disorders, how they're diagnosed, disparities in those eating disorders, and how they can be best addressed. Also, Drs. Beth Feingold and Xiaobo Zhu have done work on food waste and looking at the food system and trying to understand how can we best prevent waste for food products in the overall food system. So very important work. I also want to say, not included on this particular slide is some work that some of our students have done, especially in the time of COVID, where they looked at food insecurity that might be exacerbated by COVID-19 and really help to find ways to provide food resources to people. A lot of work going on around food insecurity and disparities as it relates to food, as well as issues related to food waste overall. And as you know, since we're speaking with the Alumni Association today, and many of you viewing this are members of the alumni, the work that you all have done since graduation is just incredible. And I'm going to show a couple of slides just to name a few of the different kinds of projects that people are doing as a way to celebrate some of the amazing public health accomplishments of the alum of the School of Public Health. One of which, for instance, is that one of the MPH graduates is now a public liaison officer and science writer at the National Institutes of Health, and really trying to best understand how do we take messages from NIH and elsewhere and craft them so that they make the most difference to people in the world. And you can see a story listed here in our magazine that tells more detail about Colleen's work in this area. To the right, we also see that one of the biomedical sciences doctoral graduates is now on the faculty at University of North Carolina, and his specialty is around cryo-electron microscopy and using these methods to study a variety of different public health challenges. So we're very pleased to see that some of our graduates go on to government careers, some go on to academic careers, and some to a number of other key different areas as well. And we'll see more examples of this as we go through. Also, with regard to alumni contributions in COVID, we found that one of the MPH graduates from 1999 is now an endowed chair and department head at University or at Indiana University, I should say, the Fairbanks School of Public Health. And we were having a conference one day trying to understand what did people in different states know about antibody serosurveys and COVID. And it turns out that NEAR has done amazing work with a whole statewide survey of what people's experiences with COVID were early on in the pandemic, as well as doing antibody testing to understand how many people might have actually been experiencing COVID-19 or had experienced COVID-19 by that time. So really cutting edge research, and we were so pleased to learn that NEAR was an alum of the School of Public Health here at Albany. Also, we see how medicine, nursing, and public health all come together. The health sciences are really, and one of our MPH graduates is an infectious disease nurse at Albany Med. And this blending of nursing and population health is a really interesting and critical one that I think could well be seen to be growing in the future. And so very glad that Lindsay is charting a course in this area as well. Wayne Lawrence recently received his doctorate from the University of Albany School of Public Health, and Dr. Lawrence is now a cancer prevention fellow at the National Institutes of Health. And he has done just incredible work on cancer and health disparities. And also, if you follow Dr. Lawrence on Twitter, you'll see great accounts of some of his work and some of his take on research in cancer prevention as time unfolds. So a great postdoc now at NIH for Dr. Lawrence. Also, some work on environmental disasters. Many of you know Dr. Shaolin and others in the school do a lot of really interesting work on the effects of things like massive power outages or hurricanes on population health, whether that's in Puerto Rico or in other locales. And one aspect of that is looking at extreme heat risk in New York State. And one of our recent doctoral graduates in environmental health sciences is now a research scientist in the Bureau of Environmental and Occupational EPI at the New York State Department of Health. And we're so pleased to see this contribution now being made to how natural disasters like extreme heat in New York can be remedied. And also I'll mention that one of the biostat recent doctoral graduates went on to do a postdoc at Harvard and now is at the University of Waterloo in Canada and is working on fetal alcohol spectrum disorders. So these are but a very few of the amazing stories of our alumni that I could tell you about today. I just wanted to name a few that are highlighted in our magazine so that you can see some of the stories and have a place to read more about them if you wish. But across the board, we are so proud of the achievements of the School of Public Health alumni. And also, I just wanted to quickly mention as well that recently the Alumni Association awarded a prize for outstanding leadership during a pandemic, and it was won by Dr. Liza Whalen, who received her MPH from the School of Public Health. And as many of you know, watching this today, Dr. Whalen is the Albany County Health Commissioner, and just day in and day out has been doing the press conference leadership in moving us through precautions on how to protect ourselves in the capital region from COVID issues related to testing, contact tracing, hospitalizations, numbers of fatalities. Dr. Whalen has done an incredible job of exemplifying this leadership, and I was so happy to see that the Alumni Association recently awarded her a recognition in honor of all of the great work that she's done in this space. So those are a few things that I wanted to highlight today from our 35th anniversary magazine, just to give you a little bit of a flavor of the School of Public Health and some of the themes of things that have been going on. But of course, during a pandemic, it's hard not to say a few words about what we've been doing around COVID-19. The magazine also summarizes some of the earlier work that we did on COVID-19, and I would refer you there to learn even more about it. But I just wanted to name a few things. And again, so many of the faculty, students, and staff have been involved in the school that I'm going to just highlight a couple of issues. And again, Tomoko Udo and Eli Rosenberg and a number of faculty, students, staff, and alums have done tremendous work in this area. For instance, but a lot of our work also, I must say, was done in close partnership with the Department of Health and with the AIDS Institute and Wadsworth Center in DOH. And it really shows how Dr. Axelrod's vision of how DOH and the School of Public Health could work closely together. For instance, the state asked us to do a study of hydroxychloroquine as a potential treatment for COVID-19. And in just a matter of a few weeks, we did a very large study that was published in the Journal of the American Medical Association that looked at whether or not this was a useful potential treatment for COVID-19. Also, we partnered with DOH to do a study on multi-system inflammatory syndrome in children, or MISC for short. And This was published in the New England Journal of Medicine from DOH. Dr. Liz Duford was the lead author on this. And of course showed that this syndrome was relatively rare in children, but when it did occur, it was really quite severe. We did work with the state on antibody serial survey analyses. They collected a lot of antibody serum samples early on, and we were able to analyze that data to get kind of a sense of how many people might have experienced COVID-19 infection in New York State as of last spring in 2020. And I'll show you some work we did on a COVID-19 outcomes continuum in just a moment. And I'll also show you a little bit of some more work that we've been doing lately on HIV and COVID-19 as an example of how the pandemic is impacting particular communities, for instance, communities of persons living with HIV. And throughout literally all of this work, an important theme has been looking at racial and ethnic health disparities and ways to try and build health equity. And this is really true throughout all of the projects. And also, I would say we've been kind of tracking the history of the pandemic in New York State. Eli Rosenberg just recently gave a talk that was kind of a tracking of everything that's happened since like late last winter in 2020 in the state. And so I think we're in a good position if somebody asks, how did this unfold month by month? We can describe it in really some great detail. So just a couple of specific projects. I'll spend just a minute on each. The first is this notion of looking at racial and ethnic disparities with a COVID-19 continuum. And what do we mean by this COVID-19 continuum? Well, on this slide, you can see it here. And we took a concept from the field of HIV prevention and treatment. And many of us have worked in HIV for a long time. And in HIV, there's a very famous continuum where you start with the number of people in a population, how many are living with HIV, how many are actually diagnosed with HIV, how many people are then linked to care, how many people are sustained in care over time, how many achieve viral suppression as a function of that care or for other biological reasons. And then finally, how many people sadly pass from HIV. And that's a very important dashboard that gives us a sense of how we're sort of doing overall in that field. And so we asked ourselves, couldn't we develop a COVID-19 outcomes continuum that paralleled the HIV continuum? And you see that here. So at the time this was done, kind of late last spring, early summer, there was a lot of attention being paid to racial and ethnic disparities in COVID-19 fatalities. And certainly that was true. But what we wanted to look at was, even before that, what were the size of populations? Here on this slide, you see the populations being non-Hispanic white populations, non-Hispanic Black communities, and Latinx or Hispanic communities. And we have the size of the population for New York State. Then we have the percentage of each of those populations that acquired COVID or SARS-CoV-2 infection. And then of persons who may have been infected, what was the fraction that were diagnosed so that they knew that they were living with SARS-CoV-2 or COVID-19? Then what fraction went on to be seriously ill enough to be hospitalized? And then sadly, what fraction went on to pass from COVID-19? And I think one of the central lessons of this particular study was that if you look at the disparities in fatalities, you can't wait until people are hospitalized to try and remove these disparities in fatalities. You have to start much earlier. You have to go all the way to the left and even beyond and look at differences in diagnoses and infection in the first place, and also in socioeconomic circumstances that may lead themselves, like in a community, having more persons who are frontline essential service providers who may not have been able to work from home during the time of the pandemic, or communities that were food insecure or had housing instability. Many different factors that may lead to differences in infection in the first place. And as CDC has recently said, racism is an important factor in public health. And we really would highlight that if we want to make a difference in these disparities here in COVID-19, we can't just wait to focus on fatalities. We have to go back all the way to the left-hand side and really be able to work on and focus on not only the infections, but also the social circumstances that lead to the infections in the first place and lead to exposure. And this slide is just really a table version of the figure I showed on the last page. This is taken from the press release for this particular paper. And we just wanted a way to sort of illustrate that if you had a community of the same size of persons who are white, non-Hispanic, Black, non-Hispanic, or Latinx or Hispanic, and there were, say, 10,000 persons in each community, how many people would become infected, diagnosed, hospitalized, or sadly deceased as the time that this was done early on in the pandemic in New York State. So it's just a different way of illustrating the same points. Last couple of things I'll mention is one, we recently did a study with New York State, AIDS Institute, and others looking at all of the surveillance data on persons living with HIV and COVID-19, really trying to ask ourselves, are there differences in the outcomes for COVID-19 among persons who are living with HIV? And we did find that there were some differences in diagnoses and hospitalizations and fatalities. And when you did the adjustments to the analyses, the statistical adjustments, what you really found was a major difference in terms of the severity of illness, of the impact of COVID-19 on persons living with HIV. And I think this paper and a very, very small number of other papers have led to some prioritization of persons living with HIV to get COVID vaccine earlier than might have otherwise been the case. Now, of course, at this moment, everyone's eligible, but earlier on, as the different communities were being prioritized, the question was, should persons living with HIV be prioritized earlier? And this is at the bottom of this slide is an excerpt from HIV.gov and the NIH treatment guidelines, which said that based on the recent literature, and our paper is referenced, that persons living with HIV appear to be at increased risk for severe outcome with COVID-19 compared to people without HIV, and should be included in the category of high-risk medical conditions when developing vaccine priorities. So we feel like we hopefully contributed to the research literature that led to informing some policy about vaccine prioritization. And then the very last study I'll take just a second to mention is Ron Valdesari, who I've had the privilege of working with for about 30 years. He used to be at CDC and other federal places. We asked ourselves, if President Biden set the goal that by the 4th of July, we would be able to have relatively small gatherings with cookouts with family and friends, what would we need to do in order to be able to achieve that goal? And what would the interim goals have to be? And this is from the same paper that Dr. Benitez on kindly asked us to be on HealthBeat to talk about this paper. And we set some interim goals that focused on things like mask use, keeping current policies in place, getting the vaccination rate up even more than it is now, making sure there was earlier treatment for persons who have symptomatic disease, making sure that we could get the number of COVID deaths down to a level that's much more like influenza than it is now, and also to eliminate health disparities in all of these goals. And I think a challenge that we're seeing now in the US is that the US has really put all of its emphasis on vaccination. And the vaccines are amazing and important. I've taken one of the vaccines myself, had both of the shots already, and I feel like it's very important. But there's been some lessening of the emphasis on some of the other areas. So we really, if that's going to be the strategy for the US to really double down on vaccinations, somewhat to the cost of these other strategies, it's going to be incredibly important to make sure that we continue to get the vaccination level up. It's going fast, but it's starting to slow now. And we need to be able to continue to move it to very high levels if that's going to be absolutely the centerpiece of everything that we do. And the last slide I will just show is that with regard to COVID, I think time is really of the essence. The numbers are still staggering. We still have about 720 or so COVID deaths every day in the US. That's about one COVID death every 2 minutes in the country. And I think we must remember, honor, and mourn every person who we've lost, not only in the US, but the 3 million people around the globe who've been lost to COVID. And we have to look at how some countries, more recently Brazil, right now India, who've been suffering just tremendously because of COVID-19. And so there's much we can do locally, much we can do at the state level, in the US and globally as well, to continue to use our partnership with DOH and other key partners to be able to address COVID-19. So let me stop there. And Dr. Applyrs and Carmelina, I'll turn it back to you, and maybe we can have time for a question or two or a comment or two. So thank you again for letting me join everyone today.
Absolutely, and thank you so much, Dr. Holtgrave, for your presentation. Good afternoon, and I am so happy to be able to assist with hosting today's town hall. So I do have a few questions for you, and to our audience, if you have a question, feel free to pop it in the chat, and if we have time, we'll get to it. So Dean, the first question is, how has COVID-19 affected the school overall? And specifically, can you speak to the implications of COVID on the school's visibility as well as student enrollment?
Great. Well, thank you very much. I think as far as the school overall, the faculty, students, and staff have done an amazing job of shifting in very short order to largely an online format. And so much of the teaching needed to move from in-person to either hybrid or online. And of course, we look forward to the day when we're all back in the classroom together. But I think everyone shifted very quickly, found ways to make that work. And I think that was really key. And also at the same time, finding ways to volunteer for a wide variety of the different kinds of applied projects and work that I mentioned before, and finding ways to do that safely as well, too. But the contributions, I think, were just incredible. I think in terms of the visibility of the school, I hope that we were able to utilize these opportunities to talk not only in the peer-reviewed journal, like in New England Journal and JAMA and so on, but in the media as well. We've had our work featured on CNN, most of the networks, the national networks. We've had work featured in many of the prominent print outlets around the country and in some other countries as well. We've done some TV work, some radio work. And I think it's really important that we not only do work that's good enough that it can be in peer-reviewed journals, we have to bring the messages about our work to everyone as well at the same time. And so I think that has been key. And then the other thing in terms of enrollment. So schools of public health across the US right now are experiencing about a 20% increase in applications. And even more so for us in the School of Public Health here at University at Albany, we've had an increase of about 30% or so in applications this year. And I will say it's such a heartening time, because I think many of us have experienced over the years that when you say to somebody, I work in public health, they're not quite sure what that is precisely. But now people really know what public health is. They see it day in and day out with the pandemic. And I think many people are sort of saying, this might be a career for me. This might be an area that I want to turn to. So we're really excited about those possibilities. It'd be great to continue to expand the public health workforce.
That's wonderful. And I too am seeing that personally, as I am mentoring 3 young women who have discovered public health for the first time, and either applying to our School of Public Health or have already been accepted and will be transitioning and starting in the fall. So I am also seeing that interest in a field that at one point it was very difficult for me to explain what it is I did on a day-to-day basis. So that's wonderful news. My second question is, how can our alum become engaged with our School of Public Health if they are not already?
Oh, it's a great question, Dr. Applyrs. And, I think a couple of things. So one is just, I'll make sure that I put in a public service announcement here to say that we have a number of summer courses, and I think many of the alums from the School of Public Health probably have already taken these courses, but in the summertime, we're offering courses in principles of public health, community-based public health, grant writing, and so on. And these are online courses. So if any of the alums of the school know people who might be interested in learning a little bit more and trying to just take a course in public health to see if it's for them, see if they like it, alums can certainly and sort of talk up our different kinds of degree programs, certificate programs, and even if people want to just take one course to try it, and these summer courses are great opportunities to do that. So that's one place. The other is, I think we're having increasing numbers of town halls and speakers. And if members of the Alumni Association aren't already on our listservs, please let us know and we'll make sure that we include you so you get announcements of those. Just for instance, last evening we had Dr. Melanie Thompson from Georgia who came and spoke with us about what we might expect in year 2 of the pandemic with COVID-19. And she gave this really remarkable presentation comparing Albany, Georgia and Albany, New York, and what did we see comparing the two Albanys and what lessons could we learn about public health? It was a fascinating talk. We will have more such opportunities yet this year and even more as we get into the fall. So if you're not already on our mailing list, please let us know. And also, if you would like to volunteer to be a mentor for one of the students, you have an internship, a field placement at your area, please let us know that as well. So those are a couple of thoughts, and Dr. Applyrs, you may want to add to that as well too.
Yes, and I just echo all of those. I had the privilege of spending a lot of time at the School of Public Health, and I can say that my training has prepared me to be responsive during many of the public health crises that we are experiencing as a nation, whether that is COVID-19, whether that is unrest due to racism and police brutality. I have been prepared, even as a city auditor. Most people say, well, what is a city auditor doing? Getting involved in conversations surrounding police brutality, COVID-19, and I'm proud to always talk about my expertise and training coming from the School of Public Health.
That's excellent. Great.
And Dean Holtgrave, last question for you. This has been such a difficult time for everyone the last year and some change, and people are starting to see some light at the end of the tunnel. Do you have any silver lining takeaways as a public health expert that you care to share with the audience before we conclude?
Oh, thank you. I think that we can be so hopeful now. I think with the vaccines and other strategies that we have before us, we could be at a place by the time a little bit later this summer or this fall that we're back at a little bit more of what we might have seen as normal. So that's great. And I think we look forward to that. On the other hand, I think we can't just say, well, we want to go back to what it was like 18 months ago or a year ago. I think a number of challenges have been highlighted by COVID-19, especially around health disparities and racial and ethnic health disparities that we see, there's been a year of life expectancy loss just in the first half of 2020. That's overall, but among Black men, it's been 3 years of life expectancy loss just in the first half of last year. And when we look at vaccine coverages, we see still a very major difference in terms of vaccine coverage. So I think the area of health disparities we've seen actually not only continue but worsen during the time of COVID. And so I think we have to recommit ourselves to making sure that we're building health equity as we go forward in everything that we do. And the other thing is, I think, we've hopefully learned some lessons about how to be even more effective in how we do public health. Because we're not traveling all the time, actually, I could participate in more conferences than I ever did before, because you could just jump on, you could hear a Zoom for a couple hours, and then you move on to something else. And I think some of those lessons, the school published an enormous number of papers last year, and I think we were sort of working in this very efficient way. And some of those things we'll be able to keep, and some we can't as we go back to the office full time. But I think we need to learn some of lessons about not just going back to normal as we reverse time to February of 2020, but what did we learn, and how do we want to build a future that's even better as we go forward? So those are a couple of quick thoughts.
Great. Well, Dean, thank you so very much again for your presentation. Thank you for all of your leadership, both locally and nationally. And I'll turn it over to you, Carmelina.
Thank you, Dr. Applyrs, and thank you so much, Dean Holtgrave. I truly appreciate you taking the time today for this wonderful presentation. We don't have any questions from our audience, but I'm sure if anybody does have any questions afterwards, if you feel free to email me and I'll forward it on to the Dean or Dr. Applyrs. And again, thank you for joining us. Have a wonderful afternoon, everyone.